KwaZulu-Natal is officially in the grips of the third wave of coronavirus infections, with officials concerned about the increase in the number of cases at schools. Premier Sihle Zikalala has attributed the surge to the recent unrest. Interprovincial travel and cluster outbreaks comes as the health department warns of a fourth wave of COVID-19 infections. Let's discuss this further. I'm joined now by the Gauteng Coronavirus Command Council member, Professor Bruce Melado, as well as the South African Medical Association Vice Chairperson, Dr. Mvuyisi Mzugwa. Gentlemen, good evening and thank you very much for your time. Prof. Melado, why is KwaZulu-Natal only talking of a third wave now when I suppose you look at Gauteng and maybe even look at the Western Cape, those numbers are beginning to taper down?
Hi, thanks for having me. We typically speak only about the Gauteng province because we have a lot of data from the province, and I want to comment on what's happening in other provinces. However, it can be argued that this pandemic has been particularly different compared to, or this wave has been somewhat different compared to others in that each province has behaved very differently from others. And whereas Gauteng started off early and now is waning fairly quickly, other provinces haven't reached a peak. Unfortunately, KZN, and it also appears that the Free State don't seem to have reached that peak yet.
Yeah. Is it too soon to be alarmed of a possible fourth wave on the Gauteng province?
Right, that's a very good question, and that's now one of our focal areas, to use modeling to understand what will be the characteristics of the fourth wave, how many infections shall we have, how many hospitalizations, types of hospitalizations, also mortality, unfortunately. So all those things are being folded in a complex model, and in the next few weeks we'll be having a well-defined model that will predict the characteristics of the fourth wave. But unfortunately, the likelihood of a fourth wave is very high.
Right. Dr. Mvuyisi, from a medical point of view, is it surprising to you that you're seeing this rise in numbers, and is there a real link between these numbers and the unrest that we saw? I mean, we know that, of course, these numbers are a little bit behind as far as 14 days or so, and what we are seeing now could have probably be because of the behavior that we were seeing last month.
Well, good evening, Thabo, and your viewers. Yes, I think we are not yet out of the woods in as far as the third wave is concerned. We note the decline in Gauteng, but we still, as having provinces like KZN, like you alluded to earlier, KZN seeming to be the epicenter now, and also followed by the Western Cape and other provinces. So I do think regarding the third wave, we're still far from over. And I do think that we need not let our guards down because of the media reports or even some expert reports telling us that we're having a decline. I think we are in a moment where we need to still be very vigilant in terms of avoiding any super spreaders and also adhering to our non-pharmaceutical interventions.
Yeah. The real question, though, is around the high number of infections that the Premier of KwaZulu-Natal is seeing in schools, and a large number of those being the pupils more than the teachers themselves. And, of course, they're seeing a similar pattern since the reopening of schools in the Eastern Cape. What do you say to that?
Well, we understand first that this wave is driven by the Delta variant, and we know that with that variant, it's easily transmissible, and it would definitely affect as many people as possible. But also, looking at our public schools, their numbers are high. Even in a class, you've got lots of congestion of pupils, and also it's not easy to monitor, non-pharmaceutical interventions with children. So it would make sense if you see schools being super spreaders because of the environment and the nature of children as we know it.
Would you say that would require the Department of Basic Education to maybe look at more stringent monitoring processes to ensure that the class sizes are strictly adhered to?
Yeah, I think there was an excitement to say that all students must come back, we understand, I mean, they need to bring children back and they need to advance children in terms of their education. But also, we need to have these measures in place to make sure that children are not exposed to a risky virus. And also, we understand that there are children with underlying medical conditions who must be protected from this risky environment. But also, if they go back to their families, remember some of these 60 and above old people in our country have not vaccinated in full. In fact, we're still urging, government is still urging them to come forward. But we know very well that we're still lacking behind in terms of vaccinating them. So we need to make sure that they don't get infected or get transmissions from the pupils. Hence, it's important that government makes sure that in the schools there is a proper adherence to the measures that are advised by the NICD and the Department of Health.
Yeah. Prof, we are, of course, at that 10% mark in terms of inoculations, which is very important, even though a large number of those are still to get their second jabs. But we are also experiencing, in terms of these numbers, more hospital admissions and more fatalities. Is that an indication of not enough people having had the vaccination?
That's a very good question. Certainly, vaccination is a game changer in the pandemic. Now, we know that the vaccines that are being rolled out in South Africa are very effective against severe disease, hospitalization, and mortality. Now, unfortunately, the third wave has hit the population very hard, has given very large numbers of hospitalization and mortality at a time when the number of vaccinations was not very high. So as a result of that and the emergence of the Delta variant, the third wave has been a lot worse than the second. That being said, now that the third wave is waning in Gauteng and we're now getting ready for a fourth wave, it's absolutely essential to understand two things. First, what is the real impact on vaccination? We can actually start measuring it as the numbers are going down, and also predict. The second thing would be to predict what's going to happen for different outcomes and different types of progression of the vaccination in the province. So that's absolutely critical right now. And in particular, one has to bear in mind that vaccination is particularly effective to reduce the severe illness, in particular in a certain type of people that are more prone to developing severe disease. So we certainly have to make sure that the vaccination be administered to folks that are more at risk to end up in a hospital, ICU, or die.
Now, Premier David Makhura saying a feedback from our social mobilization outreach teams is that 18 to 34-year-olds are keen to take the jabs. 5.1 million of them in Gauteng. We'll hear that this we're hearing that this is coming soon. How soon can we expect that to happen?
Right. So understanding vaccine hesitancy is absolutely critical. And vaccine hesitance is a very complex problem that affects different age groups differently. Now we are gathering more and more data. As you know, people down to 35 years of age are now being vaccinated. We had a campaign with 60-year-olds, and that's still in progress. And we do have a better idea of how different groups and age groups are affected by vaccine hesitancy. But that's going to be absolutely critical vaccination will be absolutely critical in order to reduce the severity of the fourth wave.
Gentlemen, I appreciate your time. Thank you very much for joining us, Professor Malari, as well as Dr. Mvisi. I appreciate you coming through on In Focus tonight. We'll continue.